So I'm going to share my screen immediately, and then let's have a look at an essay. All right. Can you guys see my screen now? Can you see my screen?
Yes, yes.
All right. So now we are going to have a look at this essay, and let's see what is good and what is bad. You see, this is why I said you should start submitting your essays on time as you're writing your session by session. So and this is very, very good. So the person that wrote this essay did well, but then I'm going to make some corrections. Okay. So this is a good attempt. It's a good attempt. Now I told you guys that essay there are two major um, topics in an essay. So you have to balance the theory, okay, with what the application. So you have to balance your theory and your topic, okay. So now, um, I like the introduction here, okay. So, but then I need a reference here. When you say mental health has become a growing concern, I don't know how did you know about that? Okay, so if you're saying something, you must. So how do you know that mental health is a growing concern? Okay, and what is the location? What is the country? Which country are you talking about? Are you talking about UK or are you talking about America? So your essay must have a location. It must have a location. It must have a population. So when you say mental health, is it for children or for adults or for adults and children? Okay, so your essay must have a location. So looking at this introduction now, I don't know the population that you want to do your mental health assessment. All right. Now I told you that writing the introduction should be the last thing you write. Your introduction should be the last thing. I'm aware that your essay is 3,000 words. So, but you should aim to write 4,000 words so that we can start to remove uh, what is not important. All right. So, looking at this essay now, the increasing demand for healthcare has made so I need a citation. What is health? So I start with a definition. What is health needs assessment? Okay. Now, the report employed an epidemiological method. That is good. That means you have chosen the type of method you want to use, right? But before you tell me about the epidemiological method, I need to be aware that you are aware of the three methods or four or five methods of health disease assessment. So you need to put you need to tell me that there are various ways of there are various methods for health needs assessment, including one, two, three, four, five. All right. However, the approach used in this essay is the epidemiological method. Remember, so when you say there are one, two, three, four, five methods, you're gonna give me the quotation. You need to give me the references. All right. So here I didn't see a reference. Where did you get this information from? There is no reference. Now, is this a report or is it an essay? Okay. So this section should be written last. So and so far so good. I assume that you wrote it last. Okay. So now, okay. So you have started your definition here. Okay. 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 I'm seeing it. All right. So let's continue. Health needs assessment is a systematic process. Okay. So I said critical writing is. There are different ways of defining health needs assessment. I've told you guys to watch my video on essay writing. I did a recent video this year on essay writing. If you go to YouTube, you go to youtube.com and you type my name, you see, you see this video here. Everyone should watch it. How to write an essay with analysis with examples. So if you watch this video now, you will know that in trying to define what is held in assessment, I need to find a way to summarize. I know that there are two or three definitions. Okay, so will you be able to summarize what those things in one sentence or in two sentences? Summarize those definitions. So this is just one definition. All right. Now, this is one definition. Now, when you're saying the benefit, how did you get that? Where did you get this information? So I need a reference somewhere here. Capacity to benefit. Okay, that is needs. So this is definition of needs, and there are different ways of defining needs, right? Okay. So where did you get this information? All right. Now, this essay is more of theory. It's more of theory than application. Now, if you watch that, I'm as if that this is here. Okay. Now, there needs to be a balance between the theoretical part and the application part. So I need to see how you are applying this thing. Okay. So wash a towel. Okay, whatever. Now you can see that up till here, okay. What I can see here is insufficient referencing. I'm seeing just one or two references here in a whole paragraph only. So look at this one in this whole paragraph, in this word now, in this whole place now. Can you tell me that is only one author that you saw this thing? Okay. So if I look at the paragraph and there is insufficient referencing, it will also make it not very good. All right. Now, then limiters of health assessment includes evidence. All right. So this whole thing here, they are all theoretical in nature. That means what? This is attempt. So this is a theory. Your textbook. Okay. This is a theory. All right. So your essay should not be just only theory, theory, theory. From here, from this definition till here, I'm still waiting to see what topic you are writing about. To remember. So the topic is on mental health. So I've not seen anything about mental health. Oh. Are you seeing that? So now, approaches to health assessments. Okay. Okay. I'm seeing this one now. This is good. This is the approach. So this is good. 1, 2. So can be approached using various methods. I would have preferred to put in 2 references here at least, because you know why? You are saying 1, 2, 3, 4. You are saying 4 different approaches now. Okay, so when you are saying different things, like maybe a list, it will not be wise that it's only from one place that you got that list. So it needs to be more than one. So here can be approached using various methods. It cannot be only one person that is saying this thing, right? So I will need like 2 or 3. So that shows me that you read very well. All right. Now the epidemiological approach is useful for identifying patterns. Good. Now I need to see where did you this is your justification for using epidemiological approach, right? But you need to give me a reference. How did you know that it is useful for identifying patterns and come? Where did you? I hope it's not just PowerPoint. you need to go to the internet, okay? Google Scholar or any of those database search for where you will get a reference to back up what you are writing. So here, how did I know? How did you know that it's important? That's the issue. How did you know? All right. So I need a reference here. From here to here, this is you are trying to tell me the advantage, right? Then from here to here, however, you are trying to tell me the disadvantage, and there is no reference too. So I need a reference here. If you're trying to justify something, tell me one or two persons that said that it is very very good, and it's not just only one advantage. So don't limit yourself to 3,000. Write up to 4,000, up to 4,000 words, so that we can now start correcting and removing. All right. So if you're writing on community participatory, remember that you don't have enough enough words. So I don't know why you're writing on the community participatory approach. Okay. Okay, so you are just trying to justify the reason why you are trying to use epidemiological approach. Okay, but then the referencing is very very insufficient. I cannot be seeing only right a tile. It's not only right a tile. You need to go to Google. Okay, I know that this is the first book. This right is the first book, right? But you need to go to Google to get other articles to support this right a tile. All right. Okay. So and then you tell me why, if you're writing on, why are you not using community approach? What's the limitation? Okay, I can see here because it can be time consuming. So that's good, and intensive. So, and you know that you are limited by time. So that's a good point. That's a good point. Okay, but I need referencing. You cannot be quoting only the textbook. So you need to go to the internet and get other journal articles to support your topic. All right. Now, an effective, okay, so the steps. So for the steps, I can see the steps here. I need references here. I need references. You cannot be writing just, you can see this whole stuff. You cannot just write only Health Development Agency as a reference. Okay. So you need to get other articles to support. This is a whole paragraph. You cannot just list only one author. No. Okay. So tell us the authors that where did you get all this information? It cannot be only one place, unless you are copying, plagiarizing. All right. Now, ethical issues. I can see insufficient referencing. Okay, see, so this whole stuff here, no reference, no reference, no reference. Then here you talked about the demography. So this is where you are just starting up the essay now. So I've been waiting for this Bradford since. Okay, so I didn't even know that you are writing in Bradford. So this is community profiling. This is good, but I need more references. So it's not only Public Health England. Okay, you can get journals. You can see I'm seeing Public Health England only, Public Health England only. So there are journals that you need to get. Get some journals. Get joint strategic health needs assessment. I told you, watch the video I did before. It's not only Public Health England that you can get the statistics. Okay. So, and this is the whole thing here that you're writing is about. Okay, I can see COPD and asthma. Okay, so this is good. This is community profiling. Okay, then this is mental health. This is good, but you need more referencing, please. So this is insufficient referencing. Okay. So this, for me, this is where the essay started, though. From this Bradford here, from Bradford, from demography, because the steps, it starts with what? Community profiling. Okay. So where this is a quotation. I didn't see your, where did you get this in from? There is no quotation backing it. Okay, so you need to rewrite this essay, but it's good at least you have made an attempt. So this is good. So I don't want to waste time. Let me bring in. It's already 2018. Let me bring in Anthony. Let me bring in Anthony. Hello, Anthony. Are you there?
Oh,
Hello.
yes, I'm here. Can you hear me?
All right. So I will stop this one so that you can take over.
All
So
right.
yeah, yeah. So time. I will continue after. Want to go? What do you want to go? Okay, so Anthony, we take us on just give us a little overview on what is required for global perspectives in health. Okay. So Anthony, over to you.
All right. Thank you so much, Doc. Hello, everyone. Good evening. My name is Anthony, just like my namesake told you. Um, First, before I start, I just want to find out if it is still Dr. Ray that is handling global perspectives for you guys. Can someone confirm for me?
Anyone offering global perspectives
Yes, yes.
there?
Hello.
Doctor.
Can you hear me? Can you hear me?
Yes.
Yes, I can
Hello.
hear you. Is this still Dr. Ray?
Yeah, Dr.
Okay.
Ray and Dr. Claire.
Oh, Dr. Claire. Okay, both of them. That's okay.
Yeah. Okay.
All right. Fundamentally, they don't. I don't know about the system now, but during our time, we did not write any exams. Their method of assessment was, giving us little formative assignments that were graded, with which towards the end of the module, they gave us a very, large summative assessment, which is the 3,000 words. So
Yes.
there's no exam. I don't know if that is the same thing you
Yes,
guys
it's
are
still
up
the same.
against now. Good.
Yes, it's the
And
same.
yes, wonderful. So global health is just very basic. It's basic in the sense that you can differentiate it from public health very simply. Public health has to do with, solving health issues or looking at health from the community point of view, looking at micro interventions that you can, unleash in your communities. You get it. But when we talk about global perspectives or global health in quote, it's just looking at health across national borders. So the scope of global perspectives is something that would look at health that concerns communities. Example, that concerns nations. We see the COVID crisis, issues about, antimicrobial resistance. We talk about antibiotic resistance, drug overdose, and some of these very issues that concern, you know, the world. It is not limited to just the effects cannot just be seen in one country. It is seen across board. So, but what is really, really very important to note about the course, particularly, is what your lecturers will teach you and their grading system. They are very concerned about academic writing. That is what I know from Dr. Ray and Dr. Claire. So they want you to discuss the facts, but most importantly, just like what Dr. Tony was emphasizing, they want to see that you understand the concept of academic writing. If you're not able to give them references to everything that you say, or the idea that you have an in-depth understanding of what it means to make a valid academic argument, because to every from the term global perspective, when you see the meaning of when you come across the word perspective, it talks about opinions, right? So they want to see you have that argument, that back and forth, the pros, the cons. They want to see the advantages and disadvantages. There's always multiple sides to things. For example, you're talking about tuberculosis treatment. Of course, there are things, there are politics that could really impact the distribution of tuberculosis drugs. The reason why countries are banned, you find out that okay, South Africa during the COVID crisis mentioned that yes, they discovered a new strain of the COVID virus. Now, global perspectives, I mean, public health will just move straight in to intervene and try to help, but global perspectives want to see how you're able to provide the argument for for the political undertones involved in it. Like, for example, using that same South Africa example, um, how the world responded to the new strain of virus of COVID virus in South Africa was that the world banned South Africa. So what does it now mean for public health? It means that if there's another strain of virus that will be discovered in South Africa, it means that the people will not be willing to what? Expose it. And when it's not exposed, it can transmit from country to country and the world becomes worse. Now, every country wants to protect their own, but there's always consequences for actions. So when you're writing your essay, we want to see the facts on ground. We want to see the arguments for. We want to see the arguments against. That is a critical thing with Dr. Ray and Dr. Claire. I was a student of Dr. Ray, so and he's even more particular compared to Dr. Claire or Professor Claire. So that's exactly what he wants to see. He just doesn't want to see a one view approach where you just tell us, okay, this is what is happening, this is what is happening. That is not how academic writing is done. That is just it, because they will not come and ask you to define what is tuberculosis, what is HIV and AIDS. All those things do not come into play. If you're talking about smoking cessation, for example, that's an international healthcare issue. So they want to know, okay, we talk about smoking cessation. Do we know that there are certain policies that promote tobacco in African countries? Do we know that that the big tobacco companies that are resident in the Western world have propagated their agenda to Africa? What is it? What are the factors that are preventing people from making the right decisions? Why is it that government finds it hard to ban tobacco companies in Africa, Nigeria, Angola, some of these countries? Because we find out that these tobacco companies help fund the government. So there's a lot of lobbying going on. So you have to reflect all these things in your essays, meaning that you can't just look at one source. You have to look at multiple sources. So that is the issue with global perspectives. We just want to see your understanding of global politics. Make sure your essay reflects international healthcare, local healthcare, national healthcare, policies that affect national healthcare, policies that affect international healthcare, policies that affect even the communities that have the very occurrence. Is very important. Basically, you just have to look at when your issues that pertains health economics, health financing, the importance of health financing in health budgeting and all those kind of um, those kind of interests for national growth and everything. So these are the things we want to see in global perspectives, basically. And in essence, if you don't have enough points to, show you have a sound academic argument, you will find out that he will tell you that your essay is not very comprehensive. There's no good argument in it. And so you find yourself getting poor grades, which is not what you want after, the whole stress of academic learning. So, but I think I just gave a rough estimate of whatever it is, but I'd probably answer more if I know certain questions on what I can touch on, basically. Yeah.
Oh, all right. So, does anyone have a particular question to ask at this point? And then, Anthony, I don't know if is it possible to give us a guide, maybe like maybe some
Okay.
let's say like the essay you used before, like to demonstrate it like the way I'm demonstrating it now. Use it. If
Okay.
you have a copy of your
That's
essay,
that's
then
the
maybe
that's the
share
point
it
now.
today.
I don't even know where some of these things, like what I discussed on was smoking, something about smoking policy in Nigeria. I really worked on smoking.
Okay.
I
Okay.
worked on
So
smoking. And when I looked at smoking, I looked at smoking at just like I mentioned, capture all these three things, look at smoking at a world level, look at smoking as it pertains to the regional politics, West Africa, look at how smoking comes down to Nigeria and to the very state you are concerned about. It has to follow that order very, very well. And also,
okay. So yeah. So
he
is
also
it possible?
mentioned something about quality improvement, because the essence for the essay is that when you look at the problem, you are now to develop an intervention. And That's where quality improvement comes in. What is quality improvement? It's just an improvement upon a particular intervention, basically. So, what is something you can do differently to change the problem that just was created? And so, if you're using smoking as a case study, smoking cessation policies are not effective in Nigeria. Okay, we've established that. We've seen the problems across international boundaries. So with quality improvement, how do you intend to improve smoking cessation policies that would in turn translate to, the reduction of smoking in Nigeria? That is exactly what he wants to see. So you're not going to follow the cycle. There are different approaches. There's PDSA, there's I've even forgotten the other one because I use PDSA cycle. So basically, some of these approaches, they want to see you carry out a quality improvement project. Okay, because that PDSA has to do with plan, do, study, act. You get it? How are you going to plan the intervention? What is going to be involved? Okay, you're going to have meeting with stakeholders. Has that worked in the past? What are the evidences that show it didn't work in the past? What are current interventions that are going on in the policy room? So you have to reflect all these things in your argument, and then there should be a paragraph that talks about what you need to do, how you assemble your team, and some of these things. Then the action itself, the steps you will take. You're going to create an education group. You're going to create a task force group that will ensure compliance, that will do all those things. Study. It's more like evaluation. You look at everything and say, okay, what can be improved upon. And so that's it. Testing small cycles of interventions until the thing is eventually eradicated to a great extent, or the aim to which you started the project, gets accomplished. So that's it. That's the issue with it. So if there are questions, I would be able to answer better. Doc, hello, are we all there? Yeah, I'm done for now.
Hello?
Yeah,
Yes,
any
hello.
questions?
Okay, thank you very much. I've heard all you said.
All right.
I have a question
Mhm.
because especially in this quality improvement thing, my
Mhm.
topic is actually in diarrhea among under five
Good.
children in Nigeria.
Mhm.
So the quality improvement now, I'm trying to work on water sanitation and hygiene programs to reduce the prevalence of diarrhea among under five children in Nigeria.
Mhm.
But, but I don't know if that's a good topic because I noticed she keeps talking about um something about clinic. She's more into hospital or clinical things where she talks about treatment improvements in clinical settings. So I don't even know if I'm in the right track.
You know,
Secondly,
yeah, okay.
secondly, the quality improvement, I use the PDSA cycle because the last assignment we submitted was a plan,
Yeah.
250 words plan on your
Mhm.
assignment, how you plan to go about your assignment.
Mhm.
So yeah, I used the PDSA cycle. However, 250 word was actually too small to try to um
Yeah. Reflect.
say what I had
Yeah.
to say. But I don't know, how do we measure the outcome? How, because when you do your planning, you talk about your objectives, how you plan to go about it, as you said,
Mhm.
organizing a meeting with the stakeholders and all. How do
Mhm.
we now how do we measure our outcome? I don't know. I think I got stuck somewhere around there where I talked about the plan, talked about the doing that study, act and do. So I'm thinking, how do I now access my outcome to know if the intervention worked or if there was any effect of my intervention in my study population? So that's my question.
Okay. If I get you correctly, the first one is about if your topic is good. From what you
Yes, yes,
told me,
yes.
the topic is okay. Now, I want to sound this. Sometimes lecturers have certain biases. So there are some people that tend to tilt towards clinical measurements, clinical
Mm,
improvements, as
Mm-hmm.
what they predominantly focus on. So ordinarily,
Okay.
that's a bias on its own. So it's not that your topic is bad. It may just not be their area of very strong expertise. But if you're able to put up a strong argument, there's no reason why you should not get something good. But your topic is good, it's feasible, is specified. You said something about managing diarrhea among under 5 years, right?
Yes, 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 yes.
In
Water sanitation
Nigeria.
and hygiene programs. Yeah. Yeah.
Okay, let me give you an example. Like, if I remember correctly, when I was looking at smoking cessation, because maybe from here I could see what we could look about that. When I was looking at improving smoking cessation policies in Nigeria that would eventually translate to reduction in smoking in Nigeria. The act phase has to do with Plan Do Study Act has to do with your outcome measures. Let's say um from the resources I found online, it was noted that Nigeria doesn't tax the tobacco companies a lot. You get it? And there's a world cap. There's a world cap for taxing tobacco companies. Every tobacco company is supposed to be taxed about 75% of its proceeds or something like that. And we found out that Nigeria is just 35%. So it means the people are going behind to lobby the government. And because of corruption and other nuances involved in it, the country keeps on going that way. So one way to measure your outcome would be that, okay, since Nigeria at its current value is 35%. So one of the ways to measure your outcome is, if, for example, if you're now focusing on improving tax returns, if the rate of taxation of tobacco products increases from 35% to what, 50%, that's an improvement. So
Okay.
sometimes the things you are measuring, the very, like, you talked about managing diarrhea. What are the indicators that show that diarrhea is improving? What outcomes can you think about? Okay, we find out that there's reduction in hospital admission as a result of diarrhea in children. We find out that, okay, um certain qualities, I think you would find those things more um in the very thing you're discussing. I don't know if you get the very point I'm
Yes,
trying to.
yes, yes,
Yeah, so
yes, yes.
those outcome measures, you will find them hid. They are just hidden inside the effects, or just very simple things that you feel that can be measured, because quality improvement has to be smart. It has to be measurable. So of course we
Yeah.
can measure the difference between 35% increase to 50% increase. That's good, 15%, and it can be measured. So you can find out that there's reduction in hospital admissions, for reduction in diarrhea, for admission for diarrhea programs or something of that sort. You can also find another indication that mothers, how can you even measure fulfillment or something of those, some of these intangible things that are not measured. So I just gave one, being reduction in hospital admissions. You can find out that um
Can
oh,
mortality rate
filter.
also
Good.
be this thing?
What did you say?
There's
Reduction in
reduction in
mortality rate. Yes, you check some of these charts in the public health records. There's reduction in mortality rates, reduction in hospital admissions. You find out that children are becoming healthier. Some of these very measurable outcome measures. These are the ways you use to evaluate the impact of your intervention. So it's to uh, look at it critically, look at your topic critically, and find out what ordinarily can improve, and then those things become your outcome measures.
Okay. All right. Thank you very much.
You're welcome.
All right. So, Andrew, thank you so much. So, just outcome measures for diarrhea. You can see here. You can see diarrhea duration, degree of dehydration, need for hospitalization. So by just doing a normal Google search, you're able to get your outcome.
Beautiful. Thanks, Doc. That's exactly it. That's
So,
exactly it.
but just have a look. You see how if you read articles, you will see how they measured it. So anything you look at this one,
Okay.
outcome measures and effect estimates. So if you open it now and read, you see how they measure this. You can select one or two or three as your own
All
outcome.
right.
So
And you
All
give
right.
references for all those things,
I
definitely.
need to
Give
contact
references.
you if there's any need
All right.
for.
All right.
Hello, Anthony.
Yes, I'm with you.
I said, if I have other questions, I'm going to indicate that I contact you, right?
Sorry, I can't hear you very well. Your voice is breaking up.
I said, if they have other questions, can they contact you?
Yes,
I mean,
you can. You can contact me. It's okay.
all right, okay. So thank you very much for your
Oh,
time.
you're welcome.
It will be very soon. We will grow to the extent of funding our presenters. So once they come, we'll dash them some dollars for presenting.
Well,
For now, we are still starting. We are small.
it's all right. No problem.
Okay. All right. Thank you so much.
Yeah, you're
So
welcome.
let's continue back to our working with community. Okay. So I'm still sharing my screen. Can you see my screen? Hello.
Yes, we can.
Okay. So, like I said, there needs to be a balance between the theoretical parts and the and the main essay. So the essay that I was reading before, if I look at the whole essay as a whole, I will say that there is more of theory, like this whole part here, everything here from here up, everything here is more of theory. Okay, so but it's good to write it like this, and then later we'll start to edit. So that's why it's good to start on time to submit it, so that we look at it and then start editing them small. So let me show you an example. I lost my own essay, so that's why I'm using somebody's own. Okay, so in this essay, I've done a tutorial on this one already. So you need to watch the videos. So look at the topic: American Indian, Alaska Native Indian, mental health needs assessment. Okay, it can be type 2 diabetes health needs assessment for adults in Bradford. Okay, obesity health needs assessment, mental health. It can be sexual health needs assessment. Okay, so now I will rather start with just leave all these places. I don't need all these places. Just leave all these places, all these four places. So now I will better start with definition of terms. Like I told you guys in the last video I did, definition of terms. So you are supposed to define your terms. I can't see where to define that, but okay, look at this one here. I can see. Let me remove this one. This is not let me remove all this. Okay, now can you see this one? Definition of terms. So the key concepts here are veteran. Who is a veteran, right? Then who is an American Indian Alaskan native? Those are the key terms. And then what is health needs assessment? So those are the key terms. So here you can see a veteran is defined as 1, 2, 3, 4, 5. That is the definition. Okay. Now look at this segment. Though critics have highlighted 1, 2, 3, 4, 5. However, in this essay, so now this is critical analysis. So though critics have said that this is a controversial term, in this essay, the preferred definition is this. Okay, that is an example of critical analysis. Okay, that is an example of critical analysis. So the first the background of your essay should be able to define the terms that you want to use. So the population. So if you compare this essay now to the one that we were looking at before, I only knew about the population after going down, down, down. So it's not always that I have the chance to start going down, to start searching for where the population is. Right. So I would rather highlight this one up. So like now, this essay is about mental health needs of, is it of adults? Is it of adults or is it of children? Who exactly are you writing about? I cannot see the person. I cannot see this. I cannot see the population. Okay, so mental health problems are what's widespread in Bradford. Is it for? Are you writing for everybody, or are you writing for children? Are you writing for adults? So which population? I can't see it, and once I cannot see it, that becomes a problem. Okay, so which population? Who is your target population? Is it adult children or is it everybody in Bradford? Okay, so this is a community profile. Here should be your community profile. Demography, demography and health. So from here is your demography. This is about census. So here is your the demography. Then okay. Okay. So health status. So I can see. So for the health status, you cannot tell me it's only this thing that you saw. You only public health England. That's where you got your data from. Another time is only public health England. So I've done a video on how to retrieve your data. So you cannot tell me it's only public health England that you got your data from. I'm seeing only PHE. That is not enough. Like I've seen ONS here. Okay. So this is demography and okay, it's okay. Demography and health is okay. So if you write something like this, a section like this, you can send it across. If you write a section on demography and health statistics like this, you can send it across. So I can see that you looked at all the various problems that are affecting Bradford as a whole. Then I can see that you also narrow down on mental health. So when you say mental health problems, what are the examples of mental health? I hope you guys are listening.
Yes, yes, I'm listening.
So when you say mental health problems are also what are the examples? I can see depression. There's no statistics here. Where are the statistics that you need? How do I know that is a problem here? Why is it Bradford that you chose? Is it that Bradford has the highest mental health problems? Okay. Okay, let me see. Okay, you said in severe mental health like schizophrenia and are common in Bradford. Okay. Now, if you say they are common in Bradford, I need to see the prevalence. I need to see the statistics. Okay, it's a claim. This is a claim that you made, but you didn't tell me the percentage. You see? So, and this is very, very, very short. As like this paragraph here. All your stuff is from Bradford District Healthcare NHS. Is that the only place? So all the things I said about data sources, you guys didn't you have not watched the video. I've sent you the materials on how to retrieve your data sources, the sites that you can use. Okay, so you were expected to download those materials, and I sent on WhatsApp group. The materials I sent are on they're on the WhatsApp. Sent the material again. Where is it again? Where is the Microsoft Word document that I shared? So I've showed you this now. So these are the websites that you can use to get your statistical data. Okay. So if you are talking about something like Stanford, like you can use this fingertips here. If I click on this down. If you're talking about something like mental health, you can use fingertips and get your data. So this is fingertips. Okay, so are you asking? Okay, so different profiles here. Now, since it's mental health, let me see what I will see as mental health. Okay, but let's say Bradford now. Bradford is look at this one. This is local authority health profile, right? Now I'll open this something like this one. Then click on region. The region is Bradford is under Yorkshire and Humber, right? Then so you are right now Bradford. View data. Then okay. So these are life expectancy and cost of death. So I want to see something around mental health. Okay, I cannot see. Let's say all indicators. All. Let me see whether I see anything around mental health. Percentage of physical health. Okay, there is no mental health here. So what I will do is to search for it. Just type in mental health. Mental health, Bradford. Let's see whether we see anything. Anything at all. Nothing here. Okay, so if I can't find anything, I can just go to Google.com. If we go to Google.com, in mental health, uh, mental health, Bradford. Okay, simple as a simple Google search. Mental health statistics, Bradford. Let's see whether we see any. Bradford cancer. I hope you are seeing it. Joint strategic needs assessment. I was telling you that you should browse on joint strategic needs assessment or for any disease that you, any disease that you are writing on. So now I'm going to just type in joint strategic needs assessment, mental health, then Bradford. I don't know how you will not get your materials. And these are the health assessment of Bradford, right? So I open that stuff now. Look at this. The spread of mental health. Are you seeing that? So you can see. So in your ACI, I need to know how many people are being affected by mental health issues in Bradford. I see here, this is as of 2020. 155,000 people are being affected. All right. What is the definition of mental well-being or mental health? What is the definition? You can get it here, and so you can paraphrase it. Can you see that there is no universally agreed definition? All right. So you can actually paraphrase this one and cite these documents. Okay. So why is your mental health important compared to England? You can see that Bradford's listing is higher. Here, up to 10.9% are higher compared to England average. So that's why, so that becomes your rationale. That becomes the reason why you are interested in this topic. Because here, they also have higher anxiety rates, okay, above England's national average. So that becomes the reason. So now, another way you can also describe the graph, assuming that you want to like write in your own words. You can actually describe this graph. That becomes that means that you are not copying. Assuming that you see that this red is England and this is Bradford. So you can say that in between 2012 and 2019, the percentage of people that's like the Bradford has had maintained above England average in terms of the percentage of people that have low satisfaction score. So it has been Bradford own has been generally higher over the past 7 years or so, between 2012 and 2019. So you can describe the graph, and that means that what you are not copying. So that's another way that you can also do it. Okay. So look at this is depression. So you can now you can see now I can write on my own words that you write this table. Now, instead of you copying this table, you can write it in your own words. So I can say that this is in Bradford City, okay? Or in Bradford, the percentage of people that have depression as at 2017 and 18 and 2018 and 19 in Bradford alone, that's in Bradford district, is 1.7% and 12.2%. So you can see that this is paraphrasing skills. Now I've been able to say that between 2017-18 and 2018 and 19, the incidence that is the incidence of depression increased in Bradford district from what? From 1.7. Okay, the incidence of depression in 2017-18 was 1.7%, right? While the prevalence of depression in 2018 and 2019 was what? 12.2%. So that is paraphrasing. I'm interpreting the table, all right? And I'm using my own words. So now, if you are saying in Bradford, if you're writing on Bradford, look at this thing here. Where is it? When you're saying inequality, when you're writing the section on inequality, we want to know what are the areas in Bradford that have the highest prevalence. Can you see that here now? I can see here the prevalence is highest around Bradford district. Okay, 12.2%, then followed by other districts. So if I want to paraphrase all these things here now, without copying the whole thing, I will say that according to Bradford District Council, that's 2019 or 2020, I will say that that the Bradford District CCG have had the highest prevalence of depression in 2018 and 2019. Now, because this is 2018 to 2020, I need to also type in to know the one for 2022. So I'm going to just say prevalence of depression in Bradford, for example. So prevalence of depression in Bradford 2022. Are you seeing that? So now I've gotten something now for 2018. Prevalence of depression. So now let's see whether we see anything. So this one is for UK. Okay, as a whole, open this one. Look at my personal profile. So I want to see, I want to demonstrate the need for my essay. Local authority health profile. Let's see anything on Bradford. Let's see. Yorkshire and Humber stats. Okay, let's see. Let's see view report here. Report. So let's see whether they will write anything on Bradford. Okay, so this is a report. This is 2019 report. So let's finish one. So one of the things that you have to learn how to retrieve data for your article. See all these that I'm doing now. So now in your profile, the life expectancy, I need to see what is the life expectancy in Bradford like generally. And in your community profile, can you see here? Life expectancy 9.1 years lower. So that means lower for men. So women have higher life expectancy. I want to see if you like anything around health, around depression, mental health. I can see STI here. Okay. This is TB, homelessness. Okay. So these are all the statistics for Bradford, but I cannot see anything around mental health here. Hospital admission, teenage pregnancy, wider determinants of health, mental health. Okay. So if I cannot see it here, then the next place I can go to is what? Apart from going to, I can go to uh journal articles. So for me to get to journal, I have to go to Google Scholar. I want to get the statistics for depression. So I say depression in Bradford. So I want to get my statistics. Depression in Bradford. Is there an association between anxiety and depression prior to and during pregnancy? All right, so let's open this one and see whether we will see anything that shows depression in Bradford. So if you read the background of an article, you'll be able to get some of the your statistics. So let me open this one. So view PDF. So I'm going to read the background to see whether I will get some statistical data for Bradford for depression, for example. Can you see now I'm reading the journals? So it's a tedious process for you to write your essay. You need to read so many journals. So I'm trying to open it. I don't know what's happening. Okay. So normally your statistics will be in your background. Normally, in the background of an article. So like this one, now I'm going to review that whether they said anything about uh whether they said anything about UK or Bradford. So common mental health disorders of anxiety and depression. Okay, they affect women. So is there any increase? So let's see. Is there anything about type 2 diabetes? Okay, so now I've scanned through the background. I didn't see any statistics. But the issue is that if you do this thing enough, you'll be able to get the statistics of depression in Bradford on the background. By the time you read 10 articles or 5 articles, just by reading the background alone, you'll be able to get it. So some articles they will mention that the prevalence of depression or prevalence of mental health in the Bradford is this. So you will get that background information. That's the kind of data from journal articles. All right. So, hello, hello.
Hello, hi.
Hello,
Hi.
what's your yes, sir?
Yeah,
Yes,
hi.
Any
yeah,
question?
yes.
Any question? Is it myself? I did any question for me? Hello, hello.
Hello.
Yeah, we
We
can
can
hear
hear
you,
you. We can hear
Doctor.
you.
Any
Sorry.
question? Any question?
No,
Lubumi,
no, no.
Jackson, Celestina.
Hello, sir.
Any question?
Yes, on that, talking about the prevalence of depression and all of that, what
Uh,
if we use it
uh,
as a basis for the rationale?
that is a basis now. Like you need to write something like that. The prevalence in mental health disorder in Bradford has risen from
Okay.
2.5 in 2017 and 18, okay,
Mhm. Yes.
to 3.5 in
Okay.
2022. So that single line becomes your rationale. That becomes the reason, the justification for your
Okay.
essay.
And then
Yes.
again,
So
having said that, can you also compare it to the national
yes, now
prevalence?
yes,
Okay.
we exactly.
Okay.
Exactly. So I don't have time to start checking out. So these are the things you will
Okay.
check. By the time you check all these statistics here,
Okay.
whether fingertips or whatever, you get your data for
Okay.
the location that you are writing on, and
Okay.
then you can just type in joint strategic
Okay.
risk assessment dashboard. Now,
Okay.
for example.
I think I have
So,
this particular one downloaded.
so now I want to check. There are many health needs assessments, okay, for this. Now look at this. There's a link. Like this is health needs assessments. So I'm going to click on this one. So Bradford they have so many different areas. Okay. So health needs assessments. Let's say for children and young people. Look at this for mental well-being. These are all different types of. So in case you have not started writing, I'll give you an example. Go and write on Bradford. Select any of these ones. Choose one. See, this is children and young people. This mental health. These are so let's say mental health and well-being, for example. Now, I open this one now. Are you seeing your materials? Things that you can quote. Are you seeing them? Or are you seeing those are nothing dimension text? So, but that's not how you read all these things, and you not know what is going on. This one is for suicide. This is mental health assessment. Like mental health. So you get your certificate that assuming it's not Bradford. Let's say you're writing in London. So let's say London joint joint strategic needs. For example, let's say London. See London. All of them, they normally do this sport. This is even 2022. Okay? So all of them, they normally do this sport. So if you go to their of the UK website, you will see all the reports. And then based on the topic that you want to write, you'll be able to what? To write, to get it. Like here, this is backing and Dagenham. So assuming that I just mental health. So you need to do some research apart from reading your textbook. Okay? Look at this one. I've even seen it. So, first time in this university, mental health. You see, the assume this is for these guys here. So spend time on their site. You have to get spend some time on the website. Spend time on journals. Okay, on Google Scholar. So let's start with the essay. The main thing why we are here. The essay. Are we tired to start on top? Are we tired?
No, sir. Well, I'm not tired. I don't know of others, but I'm not tired.
Okay. All right. Okay. So like I said, you have written the theoretical part of the essay. Okay. Everything here is more of theory apart from community profiling. Now we need to start applying it. So let's look at the thinking in the application part. Okay, so how do you apply it now? Like I told you now, the first step in your health needs assessment from the PowerPoint, I said it is community profiling, right? So you have done your community profiling, and I think that is fair enough. Where is that essay? So you have done your community profiling here, which is your community profile from here. Here, you can see it clear from here as evidence in. So this is your community profiling, right? So up to here, that should be it. I think. Is that correct? Yeah. So now from here now, I don't know. I don't really understand what you're writing. See from here now, they didn't. You are not asked to discuss. They didn't tell you to really analyze health needs assessments. That's not the question. The question is health needs assessment of whether it's adults or mental health needs assessment of adults with obesity, for example, or adults in Bradford. So this this whole paragraph now is just good. And it doesn't really apply. It doesn't really I don't
Can you?
mean don't
Hello?
delete it yet. Yes, I can hear you.
Hello?
Oh,
Yeah.
hello,
Please,
sir.
please let me come in. Let me come in because I understand what she was trying to do there because we have an assignment guidance, right, for this
Mm-hmm.
particular health assessment. And in the assessment guidance, he told us that in
Okay.
the body of
Is
yes,
it from the
he
school?
told yes, from the school. Yes, as part of it. I think it
All
was
right.
our second
Okay.
lecture by Dr. Chilaka.
Okay.
So he said
All right.
that as part of the body, when you're discussing after your introduction, that you should try to link um your I think it's about the issue now or the population to the stigma
Okay.
to
To
power.
power, stigma, and all right.
Yes. So
Now,
but
now let me
portion
excuse me.
done in that okay, okay.
Now,
Okay, I'm hearing
good.
you.
Now, I want to show you how to do it. This is not how to do it. This what you
Okay.
did now is just theory. You didn't apply the topic.
Okay.
So let's say you want to talk about power. So power is just one part. Okay. So
Mm.
now now let's say overall okay, this social determinants. So now when they say that issues around power, let me see what is imparted by power dynamics. Okay, all right, good. Now from here to here is theory, which is good. Okay, this is good now. Okay, health assessment is impacted by power dynamics. That's a good topic sentence, right? Which can so this is your topic sentence from here to here. So now let's write about power. According to fact, power is distributed throughout the society, and this should be considered to ensure the HNA is fair, and the distribution of power can impact. Now this is theory. From here to here, now you will now went and dropped into stigma. So if you watch the video on writing, I said that after writing the theory, now you have written the theory. This is imparted by power dynamics, which can influence. According to power is, number one is that power is defined as what definition, right? That's the first part. So now I didn't see power is you didn't define what's power exactly. Okay, that's number one. Number two is
Okay.
that you have written the
Okay.
theory and you didn't apply it to
Okay.
your topic. And if you watch the video I did on,
Mm.
I don't know, all these videos I used to tell you to watch. People don't watch it. Abi. You are waiting for live session. I will not keep myself. Once I have done a video, it is left your duty to watch it. I've explained critical analysis, and I said when you write on or when you introduce a topic, let's say for example now, let me see, approach to community development. I want to see where I applied it. Mm, the principles. Okay. Now look at this. I was writing uh on bonding. Okay, so look at this. From here to here is theory. Now this whole place is theory. I've written on theory, just like you wrote on power. Now this whole place is textbook. Are you seeing that?
Yes.
Are you seeing it? Good.
Yes.
So after writing the textbook, I want you to now apply it to your topic. Look at here. Here is application. Okay, I'm applying it to my topic because I'm writing on obesity. So, for example, I'm now linking this. I'm now trying to apply this whole thing I did here. Then I want to apply it to my topic. So and then I now search for internet for a journal that applied these principles, okay, to my topic. So if you're saying power, how does power and health needs assessment, how are they related to mental health? That's to mental health needs assessment in Brafo. So I cannot come and start start doing the research because you don't take time. So let's say power is related to empowerment. What they're asking you at here is actually how does empowerment, okay, relate to mental empowering. So that's why I said you need to have a population. So empowerment of adults, its mental health needs in platform. So let's say that your population is adults. So because you didn't define your population and it's hard for you to know what to do. So look at this empowerment of adults. I'm seeing mental health and groundwork. So can open this one. So let's say it's adults that are chosen, not children. It's adults are chosen. So how how are they empowering people? I'm just trying to look at their site and see whether I'll see anything. Okay. Now I'm seeing something like child and adolescent mental health service. Um, okay. So let's see. Mental health is important. Evidence there are 5 steps that you can take to improve your mental health and well-being. Number one, there are five areas these are 5 things that people can do to improve their mental. I've gotten 5 things. Now I need to research on all these things more. So now you can see I'm getting five keys now. I need to now what look at them one by one and see what is Bradford doing about mental health. They said you should click on this page to find out. So there is a big research. You 5 ways to improve your mental health. So I cannot come and use this video and start doing the research now for you. So, but what I'm saying is that already I've seen five things, and I need. Okay, now I need to find out how is Bradford. What are they doing about this 5 things? How are they applying it to improve mental health? So you explore is actually exploration. Okay. So I will not use this video. It's going to be very long, so I cannot use this to start telling you what and what. But on ordinary Google search can give you idea from their website, so you know what are they doing. You click on all these links here. Healthy minds. I'm seeing healthy minds. Even if you go to the UK
Okay,
website,
can I say something here, sir?
yeah, yes.
I'm sorry to come in here, but if I don't say that, I might forget. Okay, now, one of the challenge we have for this report is we have just 3,000 words, and I mean before now I had over 5,001, and I have to start cutting down till I got to where I got to, and it's a bit of a challenge because the words we have so much to write, and then we have limited words to write to submit on. But under that power, I stated that it is important. It talks about I mean having the voices of people heard. That's the instance I gave there as an application for
That's good.
power. If you read further, yes, if you read further, that's what I gave. That's the instance I gave there. But I had given a longer one, but I had to now summarize because it's too. I mean, I just wish that we have maybe 1,000 words more to write on these things. Maybe we'll be able to write so many other things.
PowerPoint so they can now talk.
Hello, sir.
I said, would you consider doing a PowerPoint instead?
Okay,
So that you'll be able to talk. Yes, and you know you'll touch briefly because in PowerPoint you're not expected to start putting authors, even though you put in your references, right? But it's good that you write the essay, so and then later towards the end you cannot convert it into PowerPoint, because if you don't write it now, you don't know what to present. So if you're saying power is related to empowerment. You cannot separate power from empowerment. Good. So now how is Bradford empowering adults with uh, mental health needs or children? Let's say that you want to now write on children, right? So you need to give an example. How is Bradford empowering children or adolescents with what are the examples? What are the policies that they are using? to
Okay.
transfer power to those that are to the disadvantaged group. That's
Okay.
what power is all about.
Mm.
So once they have introduced the remember nothing stops you from getting your the textbooks that you used before, the textbook that you used in health promotion that
Okay.
talk about empowerment. So nothing stops you from referencing them too, because they are all related. They are still public health. So you can also go back to empowerment and look at like you can just type in empowering. Like, I remember in those days I typed empowering um, adults with obesity, something like that. I typed empowering adults with obesity. I think in my own time, adults with obesity. So empowering adults with depression, for example, depression. So even if I don't see I don't see in empowering adults with in UK, for example, I will see gov.uk. Okay, look at this one. UK. Oh, this is nice guideline. I want to see gov.uk website. Gov.uk. Aha, see that. I don't know. You always get a good starting point from gov.uk website. So good. So you can see now. Can you see that this well is linked to all our health, applying all our health policies. So you can use it to back up your topic. So now, promoting mental health in your profession. What are the things? 1 in 6 adults report common health disorder in England. So if you look at it, that's not how you read all these things, and you will not get an example of what is the UK doing, and then what is Bradford doing. So now the session on social inequality, the where you wrote about social inequality, where is that place now? So stigma, okay, stigma can also impact health and among people who are living with mental health. This is not, this is just theory. Okay, I see in Bradford, and I was looking for it. Okay, in Bradford, people with mental health illness face significant barriers. I want to see percentage, some statistics now. How many people are experiencing stigma? When you say people, see, that's why I said you can narrow it to adults or children and adolescents. Okay, how many of them are facing stigma? How many of them are facing stigma? When I try now empowerment. So you see this one. So this here now, okay, empowering them to have a voice. See, this is more of power now. Okay? This is more of power than stigma.
Okay.
So so sometimes after that thing, you need to like read it again and see the areas that can be affected. Okay, so but now what I want you to do is to use the steps, about 9 steps for health assessment. There are steps. Now, when you use that steps, you now think about where will this power and stigma, where will it? Because this thing should start writing a section on power and stigma. No, what they are doing is health assessment, not to discuss. This thing should discuss power topic and then discuss stigma. No, rather what they're supposed to do is, where's my PowerPoint? Let me get my PowerPoint. Where is it now? Uh, okay. Oh, okay. So steps in. Have you guys watched the video on the steps in hearing assessment? Okay, now okay, this is a draft that I used initially, even though it's not the final draft anyway, but it's a first draft. Now look at how I started my AC. I don't even know I even have this thing. This is how I started my essay. I went straight to, because my essay was on obesity. So I went straight to getting the background. Are you seeing me? But are you seeing very well?
Yes.
Good. So now
Yes.
I went to get my statistics first. I'm using both journals and Bradford Cancer. Now, obesity is a growing concern worldwide, and then in the UK. You see, you're right at that, but I didn't use only him. Now, I started in the world, what's going on. Then in England, I using my statistical data. I'm not just saying it. I'm using journals. Then in Bradford, this is what's going on. Now, if you're talking about the inequality, these are the groups that are more affected. It's affecting more children. And remember, my topic was obesity in children. Okay. Now I defined my variables, which is BMI. Okay. And then forget about this whole stuff here. Now this was my initial time of trying to get the essay. So I now introduced health in this assessment. Health assessment is one of the functions of public health, and I now defined it. Okay. Now I now link it to my topic. Are you seeing how I link it? Assessment of healthiness of private is important. Why is it important? I'm linking it to my topic. I'm not just discussing healthiness assessment. I don't know whether you are getting the difference.
Yes. Yes.
Now, healthiness assessment is one of the functions of public health. Okay? Now, assessment of health is important because assessment of health is of Bradford community, and not just you're not just discussing rationale. I
Mm.
mean theory. Theory. You're not just discussing theory. My topic is obesity in Bradford. I think whether it's adult or children, I don't even know again. Now, it's important because if you head the design and teach health policies, okay. Now, can you see that I'm using journal? I'm not using only that textbook.
Okay.
So you have to find journals about the topic. Now, according to Robinson and Eka, that's the textbook now. From here now, it's textbook again. I'm going back to textbook. This one now, yes, textbook. FNA mainly deals with whatever. Obviously, these are all textbooks here. From here is textbook. Now, forget about this. This is just half. So this wasn't the final essay. Okay. But I think I'm going to drop this essay just so you might pick up some one or two things from here. This is critical analysis on health assessment. You don't waste time in that. But you just pick up so but you don't waste time in various perspectives about research. So all right. So that shouldn't be your whole these are all the show of health assessment, the different definitions of health from different perspectives. Okay. Now this one is benefits of health assessment. Everything here is theory, but it's not. This is not the final draft. I'm just. This was at the initial time when I was trying data materials. Okay. Now, I think okay approaches. This is on approaches. So that I was writing about. So you see, you have to state the different approaches. So the person will know that you know them, right? Now, which approach do you want to use? I said that for me, a comparative approach will be used. Are you seeing that? So I've said the one I want to use. Okay. And now I'm showing how I want to use it. The Bradford area data will be compared to similar districts in West Yorkshire. Please don't go and do this comparative. It's very stressful. Just use your epidemiological approach. Because I hope you guys are getting me. Hello.
Well, yes, sir.
Yes. Yeah.
Hey, I hope you are not sleeping. No, don't go and use comparative approach because see, I was comparing different districts in West Yorkshire. That's a long Just use
Mm,
your normal epidemiological. That means you're comparing only Bradford maybe to England, stuff like that.
okay.
And that's it. Simple as that. Okay. Now, let's say. So after, I think I'll share this, but this is not the best case anyway. It's just this is a draft. I can't remember
Draft.
where I the relevant stakeholders. Like I told you now, you identify the stakeholders you want to use for your health needs, and identify the resources that you want to use for your health needs. And then if there are any ethical considerations for you, you identify them. And
Okay.
then cultural competence.
Mm,
So now, I've identified everything I need. So now the next thing now is for me to now start to now start the health assessment, of which I've explained to you all those things in the okay. So
mm,
before let's see. This is a draft. So just pick the one that's done for you. So you can see this is my community profile. I still have to say this is my community profile. Okay, so my community was children. See, living
mm,
in Bradford, and then I defined who is children. A child is someone that is below 16 years of old. Okay, so why the first children and adolescents who have reported obese. So my target population was what? Children and adolescents who have been reported as what? Being obese and overweight, and they are below 16 years. So that is my target population. So you must have a target population. So this is my community profiling. After I've done all my research, you see, I'm getting my pages, everything. How many people? This is just the Bradford profile. Okay, this is from National Census data and Public Health England. So I went straight to the as in okay. So this is still community profile. Okay, so some of these things here you may not write all of them. Some of them needs to be removed. So this is not the best. Just a draft. I have to delete some of these things. Okay, so now these ones health is not important. So you just look at it and then next one is health status of Bradford. That is the health status of Bradford now generally for all the diseases. So I retrieve the census data here. Okay, I was trying to interpret those data on my own. Okay, so you can see maternal smoking, air pollution, mortality rates. Then I'm now going straight to my own topic indirectly. So data on physical activity. Okay, then health inequalities in Bradford. So I now use the local authority health profile that I showed you before to demonstrate health inequality. For instance, male to female. So I was trying to interpret, paraphrase these things. This ratio, I'm the one that developed it. So trying to escape plagiarism. So can you see that the percentage was 73, 77, 51 for male and female respectively. Now this value was lower than England's average. So these are the health status, both the mortality, infant mortality, everything. Now, okay. Now before I now came into my own obesity now. So in England, this number of children were obese. Okay. So so remember that when they're talking about social determinants, you are writing about social determinants, right? So it doesn't mean that you should come and label it social determinants of health. Where is that place that you wrote? Hello? Are you guys still
yeah.
Yes, we're here.
there? So when they say social determinants, it doesn't mean that you should give the heading. Like, I mean, like, if you use that word, social
Okay.
determinants. Determinants are actually, what are the factors now? You can see in my essay, I demonstrated this. I didn't really come and start saying it's social determinants. So
Mm,
there are different social determinants that impact. Look at this one. When you say social determinants, there are different social determinants. So, such as what? Quality and access. So, you go straight to the point. What are the things that affect them? Quality and access to food, water, clean air, job, housing, social net. Those are the social determinants. So, show you now, look at my own now. This is my topic now. In 2016, the percentage of children with poor households, are you seeing the application now?
Mm.
Was higher in Bradford compared to what? England.
Grand.
Oh, only so when the kind of thing they didn't say you come as you come and now start writing theory on how social determinants can affect health. That's not it.
Okay.
So this whole so when you write some I these are the social determinants that are important for me in my own topic. I listed them: quality, access to food, clean air. So now I need to now go to what to go and get my statistical data to prove it. All right. So that ethnic, this is ethnicity. Okay. Now here I didn't get any uh, statistics, but I was able to find the journal. That you can see. So I was able to find two journals that demonstrate that ethnicity is important. Is an important social determinant. Okay. Now, under ethnicity, I can still see that ischemic heart disease was higher among Indians compared to Arabians, South Asians. Okay, so when you are saying health inequality, it doesn't mean that you should come and just okay, writing theory. Health inequality can affect health. No, this is the health inequality we're talking about. Can you see that ischemic heart disease was higher among Indians, okay, and lower among Caribbeans, while South Asians were at more. This is the health inequality. So you demonstrate it, not just to come and start writing it. Demonstrate it. So I can say that I can write at the beginning part here. I would say that I can write maybe ethnicity also affects uh ethnicity. Sorry, I would say that there are health there are ethnic inequality. Okay, no, I would say equality inequality is also distributed inequity in health among obese children in Bradford can be found along ethnic lines. So now this becomes my sentence. Okay? I will now demonstrate it now using an example. Are you seeing that? So this first part becomes my topic sentence as from here to here becomes my topic sentence to introduce the topic. Then this becomes my what demonstration, an example, applying it to my topic. Are you seeing that? Hello, are we still there?
Yes.
So so I'm going to share this particular. This is not something important. This is just to give you a guide on what to write. Okay. So now when you're talking about barriers, uh, it doesn't mean that you should just go and just discuss the barriers. Can you see my own? Look at this one. I gave example that I apply to my topic. So perceived barriers, I even underpinned it to theory itself,
Theories. Mm.
ecological system theory. Okay. Now the barriers in tackling your topic, not just to tackle health assessment. The barriers in your
Mm.
topic. Okay. So now I use journal and a textbook too. All right. So another good thing that you can do is to get a textbook on your topic. Go to library, get a textbook that covers like now you are writing on mental health. Go to library and search for a textbook on mental health UK and or even online self online library. You see some textbooks. So that textbook will now guide you on all the references that you need.
Okay.
So a textbook will help me here too. Okay. So So evidence of the, so you can see I'm going to get evidence of demand, admission rates for obesity. You can see. So I had to retrieve all these things from Google. Then evidence of supply. Supply now means what are the things that Bradford have in ground already for obesity.
Okay.
So these are the policies that they have done before in the past. Every baby matters, Bradford Food Group. So you can see fuel for food. So I had to get all this things. Let me so I will know what and what that they already have done. What are the programs they have done before in the past to tackle? That's my evidence of supply.
And the
Then
gap.
then what are the gaps now that are there? That means these are the needs that are identified. And all these ones: starvation, poor housing, low level of diet, whatever. Okay, unavailability. So these are the issues now. So your essential, you should have the issues after everything. What are the next thing that you have identified, right? Then you now prioritize all these things. You now prioritize. If you watch my video, you now prioritize, give them numbers to prioritize them, and then let's top two that you want to add or one that you want to solve, right? So this is me trying to write up the this thing. Okay. I think this is now my indicators. Remember the outcome measures that I want to use, how I want to measure my progress. Okay, exercise level. So these are my indicators. GP waiting time. This is still when I was trying to conceive the essay. So these are my charts, the things I got that time. So it was very stressful for me. And these are all charts. So maybe I'll just drop it for you. You can see I had to retrieve these things from the census. These are census data. So if I don't, I would have just done PowerPoint and save myself stress. Okay. So this is me trying to design the tables, just to show how Bradford is important. Can you see this is Bradford? Yeah. Okay. So the reason why I didn't get up to 70 is because I didn't outline the steps. I didn't outline the steps in healthiness assessment. That's the only reason why I didn't get 70. So you have to list the steps. Because I went very deep. So if you go straight to the all these are not for you anyway, but then I'm going to drop this essay on the group so that if I help you, at least just have an help. Because it's not perfect. It's not perfect anyway. But it might be able to
Thank
guide
you.
you on what to do. So we didn't do working with community again. I think we are tired. So we're going to stop here so that any question.
Okay. Just, hello, sir.
Any question again?
Yes, I just want to ask, have you identified what is currently being done in your in a topic that has been picked? Let's say mental health, for example. Now, I know we have several mental health services that are currently in Bradford. Having
Yeah.
identified all of those things, and how do you do the evaluation? Because
Good.
that's where
So
I'm
now,
stuck.
good. So I told you guys to watch my video and you have not watched it. Eh? So if you log into your portal, you will watch
Yes.
the video on Riot. I demonstrated it. So there's no time that you see
Okay.
someone almost hour. So go and log into your portal and watch the second video. That one is practical. No, sorry, the first video. The
Okay.
first video. The first video. So if you go there and watch it, you're able to prioritize. I even gave you the materials, the table for prioritization.
Okay.
How you prioritize your and then select. You can then even develop an intervention plan towards
Okay.
the end of your. So I think this my lesson. I was just on the video. I think it will clear up some things to help to. So
So on this basis now, it's just a thought anyway. I just think
Yeah.
that already we have so many interventions on ground. So based on those interventions, can we make recommendations instead of interventions?
No, just when I say intervention, I don't mean, let's say, you can be health education.
Okay.
So that means your indicator now will say, let me say that you might give a questionnaire, assess
Okay.
their level of knowledge. So let's say, assume that you assessed it, and it's like 50%. Then your intervention is to now do health education. That means like liaise with hospitals to educate adults with
Okay.
or parents. So after you
Okay.
have now educated them, how
Yeah.
will you measure your progress? You give them the same questionnaire again,
The same question there again.
and
Okay.
then so you maybe you at the end you said, okay, it improves from 50 to 70%. So intervention is not counseling that you can do. So watch the first video on health assessment, and then you watch the second video, and
Sorry, I think sorry, think I'm a little bit confused here. Now, I mean, what you just said now, this intervention that you mentioned, I mean, administering questionnaires and all of that. I mean, considering that we're not doing a secondary
no,
health needs assessment, it is a primary health needs assessment. I mean, how do we put that into? I mean, I don't know. I think
no.
that's where I'm really stuck.
What I'm asking,
Oh, I can't hear. Oh.
I said you have done the health needs assessment. You have used your implementation method
Yes.
to so you are done with the health needs assessment. So you are now designing an intervention.
Okay.
So you would talk to people that you are going actually whatever.
Mhm.
So having identified the needs, you propose this is the intervention that you want to design, and
Mhm.
this is how you are going to measure the impact of your intervention. That means by giving a questionnaire before and after,
And
or by doing a focus group interview again to assess the level of knowledge. So it all depends on
okay.
you.
Thank you so much, sir.
Okay. All right. So, and then we continue.